p.m. here on WeFM 99.9. Your health matters. Ask Dr. Thompson any burning question you have related to health. Your health matters. Dr. Thompson will examine healthcare, highlight important environmental issues, and look at what's hot in science and technology and the next wave of emerging diseases and health trends. So this and every Wednesday, join us 8 to 9 p.m. on WeFM 99.9 because your health matters.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, good evening. Good evening. Such a wonderful week. Tomorrow, cricket. Kamal, you going cricket? I'm going. I got a ticket. A ticket PH Vera stand. I'm gonna be there. A couple of days after, I'm gonna be there again for a night game. Just one night game, but at least I could say that I was there, you know. But this evening, of course, we're a health program, not so much of a public affairs program. I'd love to talk about lights and so, but I'd love to talk about cricket, love a form of exercise which we sometimes need to talk about. But I'm talking about something called cholesterol. A couple of callers asked me to talk about this, and I have been putting it off. Shaping up to talk more about diabetes a lot more this year, but what let me ask you, what the hell is cholesterol? Come on. You know what I mean? I had to say, what is cholesterol? You know, cholesterol is a type of fat, a type of lipid, as it's called. And guess what? It is important to your body. Oh boy. It's important to your body. It's essential. And cholesterol is so important that inside your tissues, the cells that make up your tissues, the lining of the cells, we call the cell membrane, the lining of the cells that make up tissue has cholesterol in it. You know, and cholesterol finds its way between other type of structures in the lining of your cell, the outer lining of your cells, right? Now, remember, there are different parts of your body, different types of tissue, but all tissues are made up of many, many different cells. And if we were to take one of these cells, one of these tissue cells, the lining of it has cholesterol in it. And it's important, you know? Now, cholesterol, besides being part of the lining of the cells, cholesterol also plays an important role in making sure that that cell membrane is what we call fluid. It's flexible. In other words, not rigid. Making sure that it's flexible and that it's fluid and allows stuff, nutrients to get in and allow other things to get out. Isn't that important? Boy, that had to be really important. But let me talk again more about cholesterol in terms of looking at what the cholesterol. So we know it's a type of fat and it is present in a number of plant cells. It's present in animal cells, right? And we don't typically see it so much in plants, right? We don't typically see it so much in plants. But it is essential for many of your body's metabolic or functional process. When I say metabolic, I mean the way in which your body works on a day-to-day basis. And let's just go through them. Do you know there are a number of hormones that are made from cholesterol? Did you know that? In women, estrogen, the female reproductive hormone, is predominantly made from cholesterol. Bile. Have you heard of bile and your gallbladder? Well, your liver produces this bile that goes into stored in your gallbladder, and that's like mayonnaise. That's like seasoning that goes on to the food and helps you digest your food. Did you realize that, come out? The bile in your gallbladder squeezes out and mixes with your food and allows your body to help digest it. And the bile is made out of cholesterol. Vitamin D. Do you know our skin can produce its own vitamin D when we go out into the sun? Did you know that? And the way in which your skin makes it, it uses cholesterol to help make the vitamin D. Vitamin D is primarily made from cholesterol. Boy, so we need a small amount of blood cholesterol because our body uses it for these functions. Let me just go through these again. The structure of the cell membrane, making it fluid, allowing things to pass through it, allowing things to get into the nutrients to get into the tissue and things to get out, because the cell membrane is supposed to block stuff that you don't want from getting in. You know what I mean? You don't want certain stuff you don't want COVID virus getting in. You don't want all kind of germs getting in. You don't want toxic chemicals and so getting in. And the cell membrane helps to block certain things from getting in, you know? And I'm telling you, it is essential for many of the body's functions, such as hormones, bile, and vitamin D. We've said that, you know? Now, cholesterol is really produced by the liver. And it's also made by many other cells of your body. It's not just the liver alone, but the liver is the one that really produces a lot of it. You know what I mean? That's the command center. And it is carried around the blood by some special proteins called lipoproteins. Now, we have realized that if you don't have bile, let's say, do you know that your body, after eating pork and other things, cannot absorb the fat from these type of foods? Bile is essential for being able to absorb fat into your body. Simple. Now, the question is, how much cholesterol does your body normally produce? Has anyone ever answered that kind of question? Did you know your body produces cholesterol? Well, your body does. Your body produces about 1 gram. In other words, 1,000 milligrams of cholesterol per day. Your body produces about 1,000 milligrams of cholesterol per day. But the total amount of cholesterol that is present and stored in most people's body is about 32 grams, 32 to 35 grams. So each day, your body is sensitizing 1 gram. your body has a store of about 35 grams. That could tell you that every day your body is also using the cholesterol, using it to make hormones, to make bile, to make the membrane, tissue membranes fluid and nice and lovely and so forth. And then let me say this to you. Your diet, you can have cholesterol from your diet, mainly from animal foods and so, not so much from plant food, but animal foods. And guess what? In average communities, you get about another 300 milligrams of cholesterol from your diet. So am I changing the way some people are thinking? That the bulk of the cholesterol that is being created in your body is coming from inside your own body. And even though you eat a lot of cholesterol, it's only about 1/3 of the cholesterol that you are basically using a day. Come on, that's strange, huh? Yeah? You may have thought that the bulk of the cholesterol that you eat is what is causing most of the problem. Now, there are certain illnesses that people can have or certain conditions that make the body produce either more cholesterol or less cholesterol. And of course, there are people who are probably eating more than the 300 milligrams on average. They're eating a lot more, maybe going to 500, 600 milligrams. And I want you to understand that that's not good to have excess cholesterol being produced. So you need cholesterol. Cholesterol is good. Cholesterol is essential, but excess, too much, whopping, bitching junks of cholesterol is not good. Can I use those words? Huh? Come out say I can use the word bitching and so forth. You know? Now, there are steps that you can take to lower your cholesterol, and we get into what really cholesterol. So, much of the discussions on cholesterol too often focuses on its negative effects, on the excess of cholesterol, and probably rightly so. That's why I'm going to focus on that today. But before doing that, I must emphasize one more time that cholesterol helps with various bodily functions, including the building and repairing of cells, especially the cell membrane, and bile production, many hormones, and other vitamins like vitamin C. There are two types of cholesterol, and we know them as LDL, we call low density lipoprotein, or LDL cholesterol. Low density lipoprotein, and we shorten this. I'm going to shorten it, keep it shortened. LDL cholesterol. And then there is high density lipoprotein, right? HDL cholesterol. Now, I'm going to try and explain this a little better. LDL cholesterol is what many people refer to as bad cholesterol. And HDL, the high density lipoprotein cholesterol, is the kind that people consider as good cholesterol. Now, too much LDL, low density lipoprotein cholesterol, in the blood can lead to some problems. So I started off by explaining to you that cholesterol is good. cholesterol is essential. Cholesterol is vital. And that now I've gone on further to tell you about two different types of cholesterol. One is a low density lipoprotein, one is a high density lipoprotein. Well, let me talk to you about this low density lipoprotein. Do you know the cells? Come on, I want to see if you engage you here. You know the cells of your body. You have one cell, another cell, another cell. They all lined up together and put together, they form tissue. Tissue of the muscle, tissue of the eye, tissue of the tongue, tissue of the lungs. Well, guess what? The cells sometimes have a little space between them. And we found out that inside your blood vessels, the line of your blood vessels, there is a very thin layer of some very special cells. And these cells, again, they can be separated. And you know what happens? What this low density lipoprotein does? Because it's small, it can get into, you know how dirt does get into the crevices of spaces, like in your bathroom, the tile, how dirt gets into that tile. I'm using some practical examples. Doesn't happen with my bathroom, you know? I'm not saying it happens with yours, you know? But I'd see some places is getting how the cracks on the side of the room and so forth, and it sticks inside, especially if the high density lipoprotein can get inside there and start to build up. And sometimes when it starts building up, you know what happens? It creates a situation where if it's building up inside, blood is flowing back. You could imagine traffic, heavy traffic of blood going through. Could you imagine some of it to take the butt up on it, right? On that dirt, on that, start to accumulate. And it forms little clots. And that builds up and builds up and builds up. You understand? And more cholesterol and more little clots and more little cholesterol. And the lining, instead of being nice and wide, that stuff starts to build up and starts to block 10%, 30%, 40% of the flow of blood passing through the blood vessels. And that's not good. Because if that blockage starts taking place to the blood vessels going up to the brain, then guess what? You're at risk for strokes. If that
can I just ask, right? To vision that the blockage that is created, could you say it's almost like a bump? You see something like a bump growing inside.
It's almost like a bump growing inside there.
Okay.
It's like a bump growing inside there. And don't look at it as being like a pothole along the road. Look at it as just what you said, a bump. You know, some elephant grass is growing inside there, the middle of the road. You understand? And as other blood is passing through, it's blocking other things. So other things are getting attached, and more this cholesterol is being deposited. And after a while, that bump could get bigger and bigger. That bump could grow so big, it could cause it. Now, sometimes it isn't that the bump totally occludes or blocks off the blood vessels. What happens is that the bump that's being develops like a fracture. It can start to break up. It can start to crack. Because it's hard and it starts to crack. And blood could start getting in and make it even swell faster. You understand? That's a bit difficult to explain. But if this occurs in blood vessels going up to the brain, the blood vessels coming up your neck I could feel one of these blood vessels now. It's my carotid blood vessel. And if that gets blocked either side, it can cause a stroke. My coronary blood vessels that supply the heart, I can't feel those blood vessels. But boy, they could get blocked. And guess what? Blood vessels going down to your legs could get blocked at many different places. And many people get what's called walking and so forth because not enough blood is getting in. There's some people who get blockages going to another vital organ, the penis and things like that, and subsequent problems. And there are these kind of problems that develop. Now, what I am saying is that the cholesterol.
Can I ask a question?
Sure.
I normally see, will when these veins get blocked, would they increase in size, the vein themselves? And if so, sometimes you look at people's leg and you see some veins and so forth. Is that result of?
Right. Well, the answer to that is no, right? No and no. In the sense that every part, every tissue needs blood. And when it is not getting enough blood, that's bringing nutrients, bringing oxygen, bringing hormones, bringing other things. It tends not to function so well. There isn't a situation whereby it naturally expands to cause more blood to flow. A bit of that does take place in the early stages. And what you then start to feel is your heart beating faster and your heart pumping harder. So partially to your answer, there may be a yes in that if I pump harder and I pump twice as fast, then I'm pumping more blood to that tissue.
I was looking more at the restriction, you know.
Right, I know. If it is going past the restriction, yes, there's a restriction, and that restriction is not good. So those organs don't start to function well. The brain, the heart, everything like that. If you try to walk up a hill and you have blocked arteries, you're gonna start getting shortness of breath. You might even start getting chest pain. Now, the other question you had asked, you would ask another question I said no to. Not just the restriction. Right, the veins. Now, veins, arteries carry blood to the tissue. These are strong, thick blood vessels. And veins, which are thinner blood vessels, weaker blood vessels, bring the blood back. You can have diseases that are preventing the blood from coming back to the veins. So you get varicose veins, or you have blockages of veins. But today, we're talking about cholesterol being deposited inside the big arteries, the blood vessels, and causing problems. And one of the problems that relates to the blockage is excess cholesterol. In other words, you need cholesterol, and I've been making that point, but you don't need excess whopping, bitching amounts of cholesterol, either in your diet or your body producing it. And that is the thesis of what we're talking about today. Let's take a break and we come back and we'll dive even deeper into this.
People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Now, I was making the point that as LDL cholesterol becomes laid down, there's a good guy, HDL cholesterol, that comes by and starts to sweep it up. Let me give you an example. You know, every now and again, a cement truck is traveling along the highway, whether coming up Gibson Corner or somewhere, and a whole set of cement comes out, and there's nobody to scoop it up. And within a matter of a day or two, that cement gets hard and leaves the street hard and bumpy. Well, I want you to consider HDL as being a pickup truck traveling behind one of these cement trucks. And anytime there's a spill, it goes and scoops it up, puts it into a container, a bag, and leaves the street nice and clean. I want you to consider that as LDL cholesterol is laid down inside your blood vessels and starts to develop a bigger bump, that growth of the bump is restricted by good cholesterol, HDL, which tries to smooth it out and scoop it up and take back the cholesterol to the liver so that it could be reprocessed again. Well, the sad thing is that the HDL only can eliminate about a quarter to one half of the LDL cholesterol that is laid down. And so if you are a person who is consuming, first of all, you're producing excess cholesterol in your body, and you're also consuming a huge amount in your diet, the HDL cholesterol that's also being produced is overwhelmed. There's not enough of them, especially if you are a person who has low HDL levels. In other words, in your blood, there's a whole set of pickup trucks, HDL pickup trucks going around, scooping up the thing. It can't do all the job. It can only remove about 50%. But suppose you hardly have any of these pickups. I want you to consider the bump starts to grow even faster. You know, the growth of the plaque, the bump inside your blood vessels grows faster because your HDL cholesterol is low. So the first thing is, boy, you want a good HDL level. And that level has to be really over 50, over 40, but really over 50. But when you start hitting the HDL level of 90, 95, 100, you're good. You know, you're well protected. You got trucks. You got HDL trucks all about your body, scooping up bad cholesterol, and that's good. But if your number is low, a few years and plaques, bumps could really build up. So how to check your cholesterol level? Well, you know, go to your doctor first of all, right? And they will test for your total cholesterol, which is made up of your HDL and your LDL. They also check something called your triglyceride, with a different type of fat, but important too. Triglycerides are bad boys as well. They're small. They just sneak in the cracks. They get into the cracks too. You ain't want them. Triglycerides, eating sweets and other things like that. Lots of foods are high in triglycerides. And you got to be ready. You have a sweet tooth, you're eating a lot of triglycerides. You know? So you should have your cholesterol checked at least every 5 years. you know, if you're relatively young, but certainly from age 45, or do it as an annual exam, you know. And if you have a family history of a high cholesterol, you definitely need to check it every year. Kamal, if you have your grandfather, grandmother, your mother, father had high cholesterol, you need to be checked every single year for it, because it could run away from you. You know what I mean? And you don't even know it. So many factors influence the cholesterol level, and you know, I've mentioned to you, the higher your excess cholesterol level, then the higher your risk of heart disease, strokes, and all these things have been mentioned to you. Now, in some countries, 50%, it's in Western countries, over 50% of people have cholesterol levels over the limit. There are two scales. I don't want to get into that. We could go with the milligrams, or we go with millimoles, right? And depending on which lab you go to, you know, you will see these results. America, they use milligrams. England, in other parts, they use millimoles. It's confusing to some people. I don't want to get into that to explain that. But there is no single cause of a high cholesterol, but there are some controllable risk factors that you could take. In other words, if your body is one of those bodies that's producing its own cholesterol, a very important factor, you should not smoke. Smoking and certain substances and compounds in the smoke, in the cigarette, help to make and cause that bad cholesterol to develop a bump. Let me say that again. So you have high cholesterol, high bad cholesterol. Okay, fine. But if you smoke along with that, the substances in the cigarette, not just the nicotine and certain other substances, are going, we call them atherogenic. They are going to make that bad cholesterol move rapidly to develop a bump, a plaque in different parts of your body. It's important. Now, what is also critical is that as you get older, the cholesterol also builds up. So Kamal, right now, he hardly has any cholesterol. His blood vessels are clean. But another 10 years, his blood vessels will not be as clean as they are now. Another 10 years from now, they definitely won't be as clean as they were 10 years before that or now. Everybody is going to develop some elements of plaque as they get older. And so age, smoking are very important. Now, we tend to also know that if you are overweight and obese, that's a signal that not just fat is being deposited inside your belly, back of your shoulders, your rump, different parts of your body, you know what I mean? You are overweight and you're obese, so we know, expect that cholesterol is also being deposited inside your blood vessels. So being obese, expect that cholesterol is being deposited inside your blood vessels as it is being deposited on your buttocks, as it is being deposited inside your belly and around your navel. You know what I mean? It's there. You know what I'm saying? I don't need to tell you so.
Doc, what would you say to somebody who is generally fat, not obese, but that is just their body structure, their body mass?
Yes, there's some people. We go today, we talk about something you've heard me talk about abdominal obesity. Abdominal obesity. This is where the fat is not being deposited in your neck, your shoulders, making your shoulder. It's not that it's being deposited in your buttocks or the inside of your thighs and so forth. It's not that you could pinch an inch, 2 inches, 3 inches on the side, subcutaneous fat. You could pinch. I'm talking about abdominal, visceral fat. You heard me talk about visceral abdominal tissue, or we call VAT. VAT. We hate VAT, paying VAT, but we also should hate visceral abdominal fat or visceral abdominal tissue. You know what I mean? It's bad, you know? And that is shown that someone who's just overweight because they have big muscles, they come from a big breed family, big bone family. We understand that. Genetics. But then even big bone breed persons can, depending on certain factors, develop abdominal obesity. You understand? A thin person could develop abdominal obesity too, but a big person could develop it as well. I thank you very much for that question. You know, so too much cholesterol circulating within the bloodstream leads to fatty deposits in the arteries, not so much the veins. This causes vessels to narrow and can eventually become blocked. We've gone through that. This can lead to all the things I talk about: heart attack, strokes, peripheral vascular disease. Now, the number of foods that do contain cholesterol, research has shown that cholesterol foods, eating cholesterol, high cholesterol foods, has a natural relationship to also high cholesterol levels. I have pointed out that most of the cholesterol that is being produced in your body is being produced naturally in the liver. But you don't want the cup to runneth over. You don't want the cup to become over full and run over. And that's what diet cholesterol does. It's not the same amount as what is produced in a body. Remember, what's produced in a body is needed for the proper functioning of our cell membranes and our walls and our tissue, making our cell flexible and fluid so that things could come in and go out and so forth. That's important. Vitamin D, oh gosh, we need it. Women need estrogen. Men have a little piece of estrogen too, but not a lot. Some men have a little more than others. You know what I mean? And all these things are important. But, boy, when you put diet on top of that and you're consuming a lot of high cholesterol foods, it's not a good thing. So you have to really choose unflavored or low or reduced fat milk. You have to choose yogurt and other products. And, you know, people with high cholesterol should really choose to reduce a number of fat variety products. And in terms of the bulk of where cholesterol is coming in the diet, is mainly coming a lot from meat, red meat. I gotta say this, you know, people love beef and things like that, but some better forms of protein from meat are either lean meats, they say, chicken, or some seafoods. But in addition, you could shift totally away from the meats, and you could go with beans, legumes. That's beans and peas, nuts, and seeds. These things are wonderful because plants tell you don't have no cholesterol in them. You know what I mean? And so eating more of these things in your diet, you reduce. It doesn't mean you can't have a small piece of beef. It doesn't mean you can't have a small piece of that. But the amount, I mean, you go to a cook in Congo Valley, and somebody pull out a calabash or a bucket, and they start to ladle and scoop stuff inside there. But that's meat. That's high stuff. So, yeah. It's a one-time thing.
Yeah, one-time thing. So it would not harm you.
Yes. Well, here's the problem, right? We also say it's good when you deal with fish. The best ones are salmon, sardine, mackerel. Do you know, I used to think those canned sardines on the shelf had to be a horrible thing. I'm sure they ain't no good. And guess what I found out? That they really retain a lot of their nutrients. They have a lot of omega-3 fatty acid. They have high protein. They're good compared to Vienna sausage. So if you're on a workplace, your construction work and so forth, buy a sardine rather than one of them kind of sausages. You know, I hate to say that, but the evidence is showing buy a can of sardines, man. You know, might be a little. No, man, get it with some tomato sauce or with some other thing. Doesn't have to be with sardine in water. Sardine, man, is good. You know, I usually heat mine up.
No, I love sardines.
But if you're on the construction site and you stuff a little bit of that, you don't want it, you want to stay away from so much from the bread a little bit. But if you want to stuff a little bit into a piece of bread you brought, your lady has fixed for you and so forth, it's not bad. You know, it's not bad. It's a bit more healthy than them ultra processed Vienna sausages that you don't know what's inside them. Avocados, oh boy, wonderful. Olives, we know about all these things, you know. And we tell you we should try and avoid saturated fats. I got to talk about that, especially on another occasion. But Kamal was talking a little earlier, just a few minutes, about, you know, that goat cook in Congo Valley is once a week. But guess what? Snack foods like chips, potato chips, like the takeaway foods,
Chicken and chips.
Deep fried foods. I'm not going to say much about the deep fried foods, cakes, biscuits, and pastries, all made with a lot of triglycerides, saturated fats, and so forth, would pump up your cholesterol. And you may not go to a goat cook every week, but boy, every day you're consuming, your kids are consuming a whole set of chips and a whole set of stuff, so that it isn't just from the age of 40. They consume it from the age of 4, right? And if I were to check them at 20, 25, 30, they've got plaques starting to build up. But I know Kamal didn't grow up on chips and cake and all this other stuff, so his blood vessels are clean right now. Yes, and that's important. So, you know, I could go on with a lot of the things, the butter, margarines, and other things like that. All these things have come to the fore. So this evening, I wanted to talk frankly about cholesterol and to give the good side and to give the bad side. I think sometimes cholesterol gets a bad rap that is totally bad, and that it's of no value, no use, But it's so important that you have to. Now, if you were to have a blood test and the blood test were to show a little elevation in your cholesterol, then don't go crazy, start exercising, look at the foods you're eating, and basically you could eliminate the ones that have in the most cholesterol content. And you could know, you'll be able to tell.
Eggs. I remember before they used to say, don't have too many eggs because it's high in cholesterol.
Well,
I think the yolk of the egg or something like that.
things have changed. Eggs are now considered to be a superfood, one of the big superfoods. And over the years, things have changed. And so when I went to medical school, they taught us that avocados were too rich and that, it didn't have in the good stuff. It was too rich. But in the 90s, new biotechnology allowed us to test foods. And so things that we were picking up in the 70s and 60s and the 70s and the 80s were totally thrown out the window by new tests that were being done from the 90s going on. Today, we're able to really give food a real scrutiny to see what's inside them, And eggs having something called choline is almost like a vitamin. It's not quite a vitamin because we produce a little bit. Vitamins are substances that the body cannot produce. You know what I mean? And essentially, choline, it doesn't quite make the list, but it's close. And eggs tend to have that. And these things are vital in the way our body function. I could go through a list of how they function, but people already remember the details. So it is crucial that you do start monitoring your cholesterol at certain ages, and that knowing if you have a family history, everybody should be asking their father, mother, their uncle, especially if these persons died prematurely, passed away prematurely. If they did, from a heart attack, a stroke, or from any of these diseases that had high cholesterol, you should take warning. And you should then start monitoring your own cholesterol on an annual basis. If you haven't had a family history, then you could do every 5 years, and so up to the age of 45. But really, we advocate that people who are conscious about their health not only read more about it, but also take heed and take action. Reading and throwing down the book or the magazine or the article, you got to take some action. And cholesterol has become a big issue of the ages. We don't have any statistics for St. Vincent, but boy, in America, Australia, Europe, 50% of the population have an elevated cholesterol level. This is not good. You understand? So one could start exercising. One could limit the foods that certainly contain high cholesterol. And you start using some foods that are low in cholesterol. You've heard me say the legumes, the peas, the beans. I always feel, our green peas are so damn good, but they're too expensive. You know what I mean? At Christmas time, say people have a bag of green peas, but boy, growing a couple of these in your backyard is not a bad thing, because you can have, it takes time to shell. And then the ratoon that comes up and getting the dry peas, all these things are good. But beans and legumes and seeds and so all these things are wonderful things that you should be going. But I'm an avocado man. You know what I mean? I'm an avocado man. I'm big on avocado for all the right reasons. And we have to. We haven't had any calls today, messages or so. This is such an important topic, And I don't know if anybody who has had experience, had a test, cholesterol and is querying them, want to know a little more what they should do, or what does this mean, or what. But, it's a popular topic, lots of information that's about for you to be able to read. And so a lot about cholesterol. But I just wanted to focus and bring it out this evening. Before at a big cricket game, I want to say it's important to exercise regularly, to limit alcohol, to manage your blood sugar, and all these sort of things. And
something just crossed my mind, Doc. When these plaque, right, it's a good word, start developing, are there any ways and different methods that you can do? Is there anything that you can do to, as opposed to reduce? You may not be able to get rid of them, I don't know, but are there things that you can do to reduce them?
Well, the first thing is to stop them from growing faster and from growing. That's the first important thing, right? The next thing is your HDL level. If it's low, they've shown that countries where there's a high drinking of red wine, right? That there's a particular substance in red wine coming from grapes, right? Resveratrol, that helps to boost the good cholesterol level. Yeah. We have also found that exercise boosts the good cholesterol level. So one thing is boosting the good cholesterol can start helping to remove some of the bad cholesterol. So you've halted the growth.
Mm-hmm.
Now you've removed some of it. Now, in general, cholesterol is going to be reduced if the right type of food, so some specialized dietings, seeing somebody and reading about what you really need to do, the type of foods you need to eat, that now shift the balance to much lower bad cholesterol to higher good cholesterol, and to also getting more omega-3 fatty acids, all these sort of things. These things will help in general. Of course, cutting out other things, smoking, alcohol, pastries, all these sort of things will also help. And you can do this without thinking that the sky has fallen in and you're never gonna love food again. And then in modern times, we can do tests, X-ray tests, imaging tests that can see how blocked your blood vessels are. And guess what we can do? We can do some replumbing. We can flush out those blood vessels and remove the plaques. We can take away and remove the plaques from inside your blood vessels. It's great to have that. That's what I'm looking forward to with our new hospital. They're looking to put that sort of thing in. I'm excited by that. If I reach an age that I need some replumbing of my blood vessels and so forth, it's great I could get it done in an affordable way by some experts and so who come in. Kamal, it's been a long evening.
Yes.
I want to bid you everyone a very special good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs.